The Caregiver course, Module 1. Objectives. It is the purpose of this course to train those who wish to learn the basic principle of this art of nursing so that they may be of invaluable assistance to the sick, whether at home, old age home, or any fragile healthcare institute. Introduction. Nursing is the art of caring for any human being who is ill, helping to prevent diseases and promoting health. This care includes both the mental and the physical welfare of the patient and is carried out under the supervision of a doctor. It demands strict discipline and obedience to all his instructions. The caregiver should be taught that nursing has preventive, promotive, curative as well as rehabilitative aspects. This is consistent involving in health education, inter-family primary health care, and good neighborhood assistance. The role of the caregiver. The caregiver is giving the important duty of caring for the patient with regards to observation of the patient, taking and charting TPR, administration of prescribed medicine, bed making, bed bath, care of the mouth, pressure sores, and other important basic nursing techniques. The procedures are vital to the comfort of the ill patient, as his bed is often his home for long periods. The importance and value of these comforts and the role of the caregiver in this respect cannot be overemphasized. Qualities of a good caregiver: reliability, self-control, complete honesty, power of observation, gentleness and willingness to do any duty, patience and understanding, loyalty to the doctor, nurses and fellow health caregivers, the patient and the family. Discretion, never gossip, dignity, neat appearance and quiet manner. Duties of the caregiver. The caregiver has a threefold duty: to the patient, to the doctor, and to herself. Duty to the patient. Be firm but tactful in all your dealings with the patient, the relatives and friends. Smile and be cheerful but quiet in speech and movement, and in so doing you will give the patient confidence. Never be boisterous. The caregiver's touch must be firm and gentle, and her actions quick and decisive. Fumbling and hesitation may cause pain or destroy confidence. Duties to the patient. Loyalty at all times. Never discuss the nature of the patient's illness, the treatment, or progress with anyone. Confidences imparted to the caregiver may never be disclosed. Favoritism is not allowed. Religion of the patient must be respected. Duties to the doctor. Absolute obedience and honesty at all times. The doctor's instructions must be well understood. A mistake could be disastrous. Report accurately all treatment given and changes in the patient's condition. This must not be done in the patient's hearing. Duties to herself or himself. Cleanliness of person at all times. Hair, hands, nails, teeth, and breath. Nails to be kept short. Clothing must be suitable. Uniform, comfortable shoes and stockings to be worn at all times and to be changed daily. Avoid excessive makeup, watches, jewelry, and nail polish. Only the wedding ring is permitted. There must be adequate rest and recreation away from the sick room. Diet must be diet must be well balanced, and meals must be taken away from the sick room. Ensure that hands are always washed after handling a patient, particularly after attending to bedpans, urinals, soiled linen, and dressings. The role of the caregiver. In a state widespread emergency, a caregiver may be called to assist in the wards of a hospital. She or he must conform strictly and loyally to the discipline and rules of the ward to which he or she is posted. She or he cannot expect to be given the work of a fully trained nurse and will probably be entrusted with simple routine tasks so as to relieve the trained nurse from more responsible work. She or he should grasp every opportunity of increasing his or her knowledge and skill of developing his or her power of observation. As she or he shows ability, she or he may be given more responsible work. The caregiver must be particularly careful never to discuss outside what she or he sees or hears. If the caregiver is unsure of her or his duty or in doubt, she or he must not hesitate to approach the person in charge for further guidance. The community caregiver. Community caregivers are an essential component of each country's primary healthcare system and the backbone of effective HIV care and support programs. Findings from the research confirms that community caregivers play an invaluable service delivery role and are an essential component of each country's primary healthcare system. According to the study, the role of community caregivers has shifted from basic home-based care functions such as visiting and caring for the sick to clinical and social support functions such as delivering medicine, adherence, and psychosocial support. Social support services for people living with HIV are becoming as important as clinical services with adequate food and nutrition, stable incomes, and psychosocial support emerging as fundamental priorities. The role of community caregivers in addressing stigma and mobilizing people to know their HIV status and seek timely HIV prevention and treatment remains essential. Caregiving roles take on countless shapes and forms. They assist older adults, the ill, and the disabled friends and families members. They help every day in small and big tasks. But if the caregiving responsibilities become too demanding, over time they become exhausted and stressed. The caregiver's typical task. When people with disabilities and older adults receive care from paid professional caregivers, they rely on the following responsibilities or typical tasks. Help to shop and buy groceries, prepare meals, cleans house or does laundry. Help with activities of daily living like dressing, bathing, administering medications. Aid with transferring the recipient in and out of bed. Assist with physical therapy, injections, feeding tubes, or other medical processes. Arrange the medical appointments and transportation to the doctor or clinic. Order and pick up medication at the drugstore. Discuss the care plan and needs with the doctors and care managers. Handle a crisis or medical emergency. Fill the designated on-call position for the family member. On short order, these responsibilities are controllable. But when illnesses occur and the demands become extensive, caregiving becomes a very big challenge. Tips for new caregivers. If you're new to the caregiving role, follow these steps to acquaint yourself with the position. Remember, it's normal to become overwhelmed and confused. Take it one day at a time for the best results and take it easy on yourself. Learn the family member's diagnosis. This will help you understand the illness and how to plan ahead. Talk with the care recipient about their healthcare wishes. Start the conversation about finances and healthcare earlier on. Complete the durable power of attorney for finances and healthcare proxy to become prepared for emergencies. Get the entire family involved and have a discussion about what's needed. Include the family member who needs care. This is the opportune time for each member to express what they need, plan for care, and ask others for assistance. Locate community resources like adult daycare services and meal delivery like Meals on Wheels. They help give relief and offer respite to the family caregivers. Don't forget to take training classes to increase your know-how and confidence. Ask for help and support. Caregiving responsibilities get out of hand when you become isolated, and don't ask for help and support. Local and online support groups are very useful. They provide connections with others like you. Caregivers' duties around the house. A caregiver assists disabled or elderly clients in performing personal care and household tasks and running errands. Caregivers usually care for clients at their homes or assisted living facilities like private hospitals. Following are some standard duties of a caregiver which might be included in the employment or experience section of your resume. 1. Help clients or residents with the activities of daily living. 2. Perform personal tasks such as hygiene, ambulation, eating, dressing, toileting, and shaving. 3. Talk with clients, give them companionship while participating in resident activities. 4. Prepare nutritious meals and snacks for clients. 5. Provide transfer assistance by moving client in and out of beds, baths, wheelchairs, or cars. 6. Change bed linen, clean and iron laundry, and assist in keeping room, cabinet, and dresser drawers neat and clean. 7. Take and record vital signs. 8. Create and maintain a pleasant work environment. 9. Help with sanitation and housekeeping tasks of cleaned rooms, bathroom, and common areas. 10. Perform general household tasks including laundry, shopping, errands, and transportation. 11. Implement and support resident care plans. A caregiver's plan task. Although a caregiver's work varies with different sets of duties each day, there are some basic tasks that remain the same when caring for a patient or a senior loved one. Take a look at these top duties of a caregiver to learn more about caregiving responsibilities and the reward that comes from caring for a loved one. 1. Prepare a care plan. Preparing a care plan that addresses your patient's strengths and weaknesses is necessary to create when beginning your caregiving journey, so that you can determine how many hours of care a day your loved one will require. 2. Assess medical needs. Does your patient have prescribed medication or need help with pain management? Meet with the doctor who can assess your loved one and create a medical care plan so that you can provide medical assistance at home. 3. Monitor medication. Monitor your patient's medication according to their medical care plan, which should specify your duties and what times of day you should provide medical assistance to them. 4. Assist with basic needs. Assist your loved one with their basic needs, which could include bathing, grooming, and toileting. 5. Prepare meals. Food preparation becomes increasingly difficult as we age. You can help your patient by doing their grocery shopping or preparing their meals and by monitoring their nutrition. 6. Housekeeping. Maintaining a home takes more time as we age and become less active. You can provide assistance to a loved one by doing dishes, vacuuming, or taking out the garbage. 7. Transfer. Your patient may have difficulty transferring from bed in the morning to chair in the afternoon, for instance. Be prepared to help them move and make them comfortable. 8. Transport. Transporting your loved one to the doctor's appointment and other activities will become a common caregiving duty. 9. Companionship. In the midst of all these duties, it's easy to forget one of the most important parts of caregiving, companionship. Focus on how rewarding it is to care for your patient and know how thankful they are to have you too. When you are challenged, these inspirational caregiver tips can help you to put things back into perspective. 10. Monitor performances. Finally, look at your loved one's care plan. Monitor the performance of their care and speak with a medical professional if any adjustments need to be made. These duties are essential caregiving tasks, but it's also important to remember to adjust them as necessary for the patient or senior that you are caring for. Assignment. Assist a disabled, sick, or elderly person in your community by performing personal care and household tasks. Number 1. Prepare a meal, clean the house, or do the laundry. Number 2. Take a picture of before and after. Number 3. Write a report about your patient's health, condition, environment, and the conversations you had. Include pictures, not less than 100 words. Thank you.